The question whether modern genomics applied to cancer is influencing outcome so far has been no. Although in 2018 we know a great deal more about cancer than we ever did before, applying that information to therapy has been very difficult. Why? Why is it that knowing that cancers carry gene abnormalities doesn't give us the answers for treatment? Well, the answers are complicated. But remember, there are about 1,000 different cancer genes. And every cancer needs 1 or 2 or maybe even 3 different genetic abnormalities to carry forward into a malignancy and a successful cancer. So if you do the numbers, 1,000 genes requiring another 1,000 genes and perhaps another 1,000 genes, and the randomness of all this, that's 1,000 times 1,000 times 1,000. That number is 1 billion. That means in essence that every cancer patient is a 1 in a billion experience. In fact, as one author put it, every cancer patient in the clinic is the only patient like them in history. As a result, our belief that we can dissect human cancer down to its genetic elements and select treatments that will specifically address those genetic aberrancies so far has been a bust. There have been many studies conducted to do this sort of thing. One preliminary study in colon cancer patients used gene testing to pick drugs. At the end of the study, only 1 out of 63 patients responded. That's a 1.5% response rate. In another larger study called the Shiva study, investigators actually randomized patients to receive physician choice or gene profile-driven therapies. That is, the gene test was used to select the drugs. At the end of the day, with 200 patients added to the ranks, there was no difference between the two groups. No evidence that selecting patients by gene test did any good. And in fact, the patients who were physician's choice very often got no therapy and did just as well as those who got a gene test-driven therapy. Why is this? Well, it has to do with the complexity of human cancer. Cancer is not a gene or a series of genes. It's a biological process that uses genes toward its best end. Cancer is a cell that uses the genetic toolbox to drive its needs. Cancer is a cell that wants to stay alive, and it will use whatever gene or combination of genes that it has at its disposal to do that. Now, those genes may be mutations, but very often they're normal genes being used abnormally. Imagine how difficult it'll be for a gene testing doctor to find an abnormality that isn't there. That's precisely what happens in most patients. No evidence of a driver mutation. No evidence that we can identify a target. If anyone wonders why this has been slow, remember, we have been led to believe that cancer is a genetic disorder, and that fundamental belief needs to be questioned. Cancer may well be a cellular disorder, and the genes are nothing but participants in the cell's process.